licensed in the state of Michigan as a social worker.
And what agency do you currently work for?
I work for an agency called Pine Rest Christian Mental Health Services.
What social work field are you involved in?
Pine Rest is an organization that offers care at a number of levels. There is a hospital-based services portion of the hospital that offers both inpatient and partial hospitalization for people. There is also residential services, outpatient services both on the main campus and at a number of satellite clinics in the West Michigan area, Iowa, and Traverse City. And then there is also substance abuse, detox, and residential programs.
What are aspects of your job?
Currently, I serve as the interim director of the contact center. Contact center is kind of the intake hub for the hospital-based services. So it's kind of like a psychiatric emergency room. People come into the contact center and are assessed for what we call level of care. We look at, do they need to be in the hospital? Will they be better served in what we call a partial hospitalization program, which is a day program? Or do they need referral to some kind of an outpatient follow-up service?
So what would you say are the services that your agency specifically provides to the community?
Pine Rest offers services at a number of levels of care to a number of different clients. Those diagnosed with what I would call mental health disorders that create safety issues for them. The inpatient programs are structured to deal with those kinds of acute presentations. But there are also a number of residential services that Pine Rest offers for individuals that might be hard to place or that might have difficulty finding those kinds of resources for help in other places.
What skills do you think you have and use for your work?
Being trained as a social worker gave me an awareness of being able to look with people at the issues that they present in a way that helps them figure out what are the things that they could change in their lives or add to their lives, what are the resources that could be available to them, so that whatever issues they might be struggling with currently that kind of impact their ability to function at what they see as an okay level of functioning, we have to kind of look at and figure out how to do that better. Usually that's more driven by their need for help than our need to find that for them.
Are there any specific resources that have helped you in your career?
I think peer support, peer supervision, being able to discuss situations with other social workers who are working with similar populations is a great kind of continuing education tool. I think continuing education in a more formal sense in terms of courses or seminars or conferences attended continue to be a real important resource in terms of staying current as well as learning new things about what's happening in the field. I also think it's helpful to be in a hospital situation where a lot of the work that we do is built on a team approach to treatment. So you're working with a number of different people from a number of different disciplines to provide the services that people need.
How are you involved in the community?
Professionally, I think the involvement is kind of originates in contact with a number of other agencies that also offer behavioral health kinds of services and coordinating with folks from those agencies to make sure that together we're meeting the needs of people and making things present to it.
What type of challenges do you run into with your job?
I think one of the difficulties is just when people present with problems that challenges have to do with a dependency often on third-party payers and their control of what we do and how we do it, needing to be responsive to their mandates regarding care.
Is there a specific way that you cope with stress?
Making sure that there's good boundaries around work time and what I would call play time or family time, so that when I'm at work, I work hard and do what I need to, but when I'm not at work, I make sure that I'm doing things that take care of me and my family and the things that I enjoy doing that aren't work.
If you could give a social work student any advice, what would it be?
Explore your options. I think one of